All right, so day 6. Remove the bandage, checking out the wound. Still really sore. I'll go over that after that. Let's see what the wound looks like. I'll get the pictures in a minute. So it's day 6. I guess it would be day 5 post-op or whatever, but Tuesday 7:15 in the morning is when I had it done, and it's now Sunday. It's 7:25 in the evening, so it's getting close to a week. It's getting a little bit easier. Moving around is still difficult. Again, once I'm up and moving, it's fairly easy to move around. So unlike before, where it was a struggle even to determine whether it was worth getting up or not, to go through the pain, with this one, I normally have to get up anyways to go to the bathroom. So as long as I'm up, I can walk just a little bit and kind of move around. I don't really get a lot of tightness or a lot of the feelings other people were complaining about for the videos that I watched. Sleeping's getting a little bit easier. Most of the pain is just from the incision. Moving the wrong way and the incision not liking it, or the bone not being kept as straight as possible, perhaps. So those are some of the things that I'm working on whenever I move. Move is one unit. And as much as I try to maintain that, you're so used to living your life with being able to turn or bend one way or another without thinking about it. So you don't always get that. Deeks, quit it. Sorry. It's not always easy to just remember to not bend. But the hydrocodone and then the methocarbamol, I'm taking one of those every 6 hours of each, every 6 hours, and that's about it. No Tylenol or anything yet. I imagine I'll start taking that. I know the hydrocodone has acetaminophen in it, which is basically Tylenol. So I'm not taking Tylenol on top of Tylenol. Again, taking 2 of those pills will make me nauseous, so I'm trying not to. Let's see if we get this. Hang on. All right, see if you can just take a picture of the wound for me. Not a picture, but just show it. It's already recording. Should be. Don't stop it.
Some person.
There's some what?
Stop moving around.
And that's one thing she was saying, the puffiness. I can feel it swollen, even through the bandage and whatnot. And using the ice packs is one way to combat the swelling, because obviously you can't take ibuprofen or Motrin, whatever you want to call it. So the ice helps to combat the swelling as far as that goes. I have to find out when the next appointment with the doctor is to go over. I'm sure they're going to want to look at the wound here. I think they said 7 days. I don't remember. It was kind of a blur going through there with the medication that was on and everything else. So all my stuff is written down somewhere for me so that I'll know about it. and then get back in and see how the cut's doing. I can start to feel a little bit of the soreness, the bruising, and things like that as the main incision pain wears down. I'm going to be going into the muscle pain and the trauma and whatnot as far as that goes. That, of course, is also going to suck. I tried the 0G chair. I guess maybe okay. But for me, if I'm positioned in the bed kind of the same way, it's sort of the same as well. My biggest pain comes from the ice bag being pushed against the incision while I'm sitting or laying down. Got to have the ice there, and I mean, it's just the bags, you know, that go in their own little case, and that goes on my back. But when it's frozen, it kind of sucks, and having anything push against the incision, even though it's the ice bags, it still hurts. So, hey, don't get me wrong, it's bearable, but yeah, pain could be better. Yeah, pain can always be better, right? So we'll see how that does, and keep you updated here. Thanks for watching.